Well, good morning. We're here. Welcome back to the J. Alvarez podcast. And today we have award-winning chiropractor, Dr. Arthur Vito, Power of Health and Wellness. How you doing today?
Good, Jay. Thank you so much for having me.
So let's talk about the business first, right? Let's talk about Power Health and Wellness. Tell me a little bit about what it is.
Sure. Well, I founded Power back in 2017. It's a multidisciplinary practice that incorporates chiropractic, physical therapy, acupuncture, cupping, different modalities such as hydrotherapy, traction, electric stim, ultrasound, various lasers.
Right.
Some of our offices, like this one, has cryotherapy. Basically, anything and everything
Right.
you want for your health and
Yeah, I see you guys
health
got
and wellness needs. Yeah.
the chamber in here. Is some pretty cool stuff you guys got in here.
This is great. Yeah, we're right now we're in the Iron Culture gym.
Right.
It's called the Recovery Room,
Right.
and this is where we have the cryotherapy machine, and it's a fantastic machine.
Right. And this is located in Edgewater, New Jersey, right?
That's correct.
Yeah, and we're gonna get a little bit more into the machine itself and what the benefits are and what it does. But like I saw on your website, 3 locations, right?
Yes.
So we're at the Edgewater one now. Let's talk about the other locations. I know you have a location in Hoboken, right?
We have
No.
2 in Hoboken. One is at the Fitness Factory on 130 Washington, and the
Okay.
other one is in Excel Lifestyle, excuse me, on 125 Marshall Street, 7th floor.
And how long have we been at all locations, roughly?
The Excel one we've been at probably going on 6.5 years now. The Fitness Factory about a year, and this one's relatively new. Before pandemic, we had 9 locations,
Oh wow!
but they were all in gyms as they are
Right.
now. So when the gym shut down, we shut down, and of course they were the last ones to reopen. Many of them didn't.
Oh
So
wow!
not to complain. A lot of people had a lot worse than we did, but it's
Yeah.
definitely been a humbling experience.
Yeah, for sure. I think COVID was humbling for a lot of us. A lot of industries took a hit during COVID, especially the gyms. People were doing a lot of at-home workouts. I remember a few of my clients were trying to buy weights on Amazon, and it was like the hardest thing you could order on Amazon at the time, right? Like trying to get just some dumbbells just to work out at the house.
I was curling the kids. It was,
Yeah.
So it was, it was definitely a rough period of time.
When did the business get started? As far as like when did you brand it? You know, Power Health and Wellness. When did it all come about?
Well, I've been doing this for 18 years, and I worked in various capacities, various people for almost 2 decades, and I learned a lot because when I first started out, I wanted to be on my own. I wanted to be my own boss, and before long, I realized that there was more I didn't know than I did, and I didn't know how to learn those things. So I decided to just take a step back and work for others who knew. And I learned a lot of what to do and what not to do
Right.
from all those people. And so when I was ready, and this was in 2017, I started Power.
At 2017, you started Power.
Yes,
Who came up with the name?
I
All of that.
did.
Okay.
I-
How did you come to the name?
Oh my God. It just came. I'll be honest with you, it sounds corny, but it just came to me one day.
Yeah, that's how it is. That's how it is with a lot of brands, a lot of businesses. It's just the name just flows.
Yeah, I had that Dirk Diggler moment when you just saw it up in neon
Yeah,
lights.
yeah.
It just said
yeah.
Power.
Yeah, I mean, I love the brand myself. I don't know who did the branding for you. The color that they use for Power, perfect. The tone, I really like how they did that.
Thank you. Yeah, I pretty much I like to not control of it, but oversee it. It's my brand, so I
Yeah,
definitely.
let's get into that. Do you micromanage when it comes to brand identity, when it comes to designing? How did the process go with getting the design?
It's probably the only part of the business I do micromanage. The branding, the design, the logo, that part is important. That's what everyone sees.
Right,
That's what everyone recognizes.
right.
So, like to this day, like back when we had the 9 offices, we were the biggest in Jersey. You could walk down the street in Morristown and see a Power Health and Wellness sweatshirt, and someone from Jersey City would be like, "Oh, Dr. Vito." It was
Right. The
so
power of brand identity, right?
Power brand identity. It's
Yeah.
not quite the Nike swoosh, but it was my
Right.
variation of it.
And I feel like as a business owner, you taking the initiative to be there for that, for micromanaging the brand identity is important because this is what represents you, right? You want to make sure you feel confident with your business card, your logo, when you're giving it out in meetings and events. This is what represents you.
Of
So
course.
what's your work schedule like? What are your hours of operation?
We normally are busy during the gym busy hours. So evenings, Monday through Thursday, from 3:30 to 8 or 9 p.m.
Oh wow.
Saturday afternoon hours around 11 to 2. And
Mhm.
I throw in a morning shift now and then. Like right now, you're at the recovery room. I'm
Right.
here every Tuesday morning, 9 to 12.
Right.
So I try to mix and match it, just give everyone the opportunity to come in and see us. But we're not in any one location 7, 6, or even 5 days a week. It's redundant.
Can we get into the staff? How many staff are in your business?
We probably have about a dozen personnel right now.
Dozen personnel. Okay.
That includes people that we hire out with, consult with, and incorporate into our business. For example, we have a physical therapist, Dr. Anthony Orlando, who's fantastic. He's in this office, he's in our Excel office. He has his own office in Hoboken as well.
Nice.
And he works with us in that capacity. He's not an official employee of Power Health and Wellness. He has his own brand, but we work together.
Right.
So our patients can have the best of both worlds, the Chiro and the PT.
Right.
Our acupuncturist works for us, Dr. Kathy Bayer. She's amazing. You
All
know,
right.
massage therapist, and every office has an office manager, a medical practitioner, whether it be Chiro, PT, Acu, or a combination of thereof,
Right.
and a massage therapist, at least one.
How do you go about hiring staff? What do you look for? What's that process like?
When you're hiring, well, there's three aspects of it. There's the medical practitioners, there's the massage therapists or the people who do the stretching, and then there's front office or back office people. Um, front and back office people, you're basically looking not so much for experience, but just commitment. Someone who's willing to learn, and that's why I always tell them the first day: don't memorize what I teach you. Ask me a
Right.
bunch of times, but learn it so you
Right.
understand it.
Right.
And that's really someone who's capable of learning, showing up on time, doing the job, and really wanting to grow with the company.
Okay.
Because it's something I got to train them. And you don't want to train different people. And you want to give them a good work environment. I've always been in that model of, like we've all been in jobs where Sunday night going to bed already stressed out about Monday morning.
Yeah.
I want this to be the kind of place, the kind of environment, the kind of culture that I'm developing. That Sunday night, you can't wait to get to work Monday morning. You're going to bed early Sunday night,
Absolutely.
you know?
Absolutely.
So that's what I look for in front desk. Massage, good hands. Techniques can be taught. Um, Strength, different strategies can be taught as far as massage, but they have to have good hands.
Right.
And they have to love what they do. If someone's on the table, and we do medical massages, 10 to 12 minutes normally. So you really have to focus on the area, and they have to get it, and the patient has to be happy. And at the end of the day, no matter who I hire for what position, it's all about the patient being happy.
Absolutely. It's
You
all
know,
about the customer.
and then medical practitioner, experience, knowledge,
Right.
the right personality, someone who could work in conjunction. I don't want to think of myself as anyone's boss. I don't want to tell them what to do. We're all professionals. We should know what to do.
Right.
So that's what I look for, someone who could do it themselves and work with me.
Right. Because then you don't have to be so much on top of them, especially that position, right? In this type of business. It's very important.
It's so important because, I
Yeah.
mean, I got to have the energy. And I want to save all my energy for my patients.
Right.
'Cause I'm not just a chiropractor. I'm their priest, I'm their rabbi, I'm their bartender, I'm their best friend.
Yeah. Yeah.
Like I'm there to I love connecting with them. I love meeting them. I love getting to know them, empathizing with their problems, sharing with them during their achievements. You build a relationship.
Right.
So that's where I like to spend my energy in that positive manner.
Right. And I'm guessing with the massage therapist also, you probably get a few massages in, right? You have them massage you, feel your patients, and see how does that work?
Of course,
The
I need to
training
know
or
what
the
everyone else is getting.
the
And you
interview.
can't just do that visually. So, I occasionally I will reassess, reevaluate them
Right.
more than occasionally. But
Right. Right.
I see, and sometimes I pick up on techniques. So people will tell me, "I wish you guys did this," or "Can you do this?" And this might be something I wasn't even aware of.
Right.
Or
I
maybe
can tell
things.
you're passionate about this, man. And we're gonna talk more about the passion and the inspiration and how you got started in the background towards the end of the interview. But I really want to focus on the business right now. And let's talk about the awards, man. Because I didn't say award winning for no reason. You know what I mean? This guy, he's an award winning chiropractor. So if we can talk a little bit about that.
The accolades, the awards, they've always been nice. I mean, it's something shiny put on your wall. People have bells and whistles. I'm not particular about them. But yeah, I mean, there's been best chiropractor in New
No,
Jersey.
yeah.
There's in Hoboken. There's
Yeah, yeah.
a couple of top 100 in America kind of
Right.
thing.
Some light, the credentials
Yeah.
are there though. The
Um,
credentials are there.
but the awards that matter to me are the best award is when my patient gets off a table and says to me, "Wow!" And you can just almost see tears, if not see tears, streaming down their face,
Right.
and you just know you just helped them. I don't want to say fix them, but you helped them, you changed them. That's my award. That's the one
Right.
that matters to me.
Right. Yeah. I definitely wanted to talk about that because I was looking through your website and I noticed that. So congratulations on that.
Thank you.
Of course. I was also looking through your website. I was going through the services and we kind of talked about them already in the beginning of the interview, right? Chiropractor, acupuncture, right? Let's get into chiropractor though. What should someone look, right, when considering booking a chiropractor? What are things they should look at? Certain certifications? What should they do their research on the practice? What are your recommendations?
I think you should always do your research on the practice. Make sure the reviews are good. Make sure that the person's got, if you do have certain techniques that you prefer,
Right.
that person is
Certain
proficient.
qualifications.
Certain qualifications, if that's important to you.
Right.
I find that in most things, it's the connection. Like you really have to meet someone one-on-one.
Right.
Also, how acceptable are they? Like, are they doing you a favor by booking you?
Right.
Are they excited to have you and can't wait to meet you? Do they
Right.
really want to help you? Do they try to find out what's going on for you? It's like, are you in pain? What hurts? Are those the first two questions? Or is it, what insurance do you have? How will you be paying for this visit?
Those are red flags.
To me,
Yeah.
because
Absolutely.
I even purposely choose to, how do I say this? I don't know what anyone's insurance is when they walk through my door. I have other people for that. I never want to see anyone as a dollar sign. And if someone sees you as a dollar sign, then they're obviously not seeing you as a human being, as someone who's in pain or injured. So they're not going to do, I don't want to talk to everyone else. Personally, I just don't want to be that guy.
Absolutely. No, absolutely. And I feel like in any business, that's important, right? And those are definitely red flags we have to look out for. Let's talk about, okay, so I book you, right?
Mhm.
What's the process like? We meet, I shake your hand, introduce myself, you introduce yourself. What happens after that? We walk into the practice, whether we're here at the Edgewater location in the recovering room, whether we're in Hoboken, whether we're at any other gyms. I know you also probably do private home sessions
We
too,
do.
right? A day, an appointment, coming to the office to see you. What is that like?
All right. So first thing is just text us, right? People text us and we have a short conversation. Get to it. What's going on with you? What do you need? What are you looking for?
Consultation.
Not so much a mini consult.
Before the actual consultation. In
Yeah,
person.
just to get a feel for who we're speaking to.
By the way, phone number's on the website. Our Health and Wellness.
Phone number's on the website.
So that's how he prefers you book.
And just 973-878-9069, just in case you miss it on the
Yeah,
website.
of course. Just put it out there. Yeah.
But so they text us normally, or email or call, what have you. And then we schedule a time for them to come in. We tell them about our locations, our days and hours. If they want us to do a concierge visit, we can get to that a little bit later if that's okay with you. Normally, they'll choose a location.
Right.
At time they'll come in. It's a one-page intake form, a couple of signatures that says we're allowed to touch you. We will never give out and sell your information, your HIPAA rights, so to speak. And then I see them and we talk. And first thing everyone wants to do is just jump on my table. I'm like, have a seat, relax, make yourself at home. Tell me what's going on.
Yes.
Let me figure out what's happening. And I can usually see what's going on with them, honestly, but the way they walk in.
My next question.
Yeah.
Right? Which is, what are things that you realize or notice off of just looking at them, right? Physically, whether it's stance, posture, right? You might have them squat, see how their form is, right? How do you go about that?
Honestly, just from their gait, their posture, their demeanor, I can already tell what's going on to a degree.
Right.
And then the first thing I ask them is, when we get to it, is what brings you here today? Right. And the second they point to a spot based on what I've already observed, I'm 99% of the way there.
Right. You already know.
Yeah.
Yeah, but that takes years, right, of experience.
Yeah.
What's the curriculum you're going to be having them on for the first 8 to 12 weeks of treatment?
Yeah, that's a great question. And I'll start the first visit with the adjustment and the massage or a stretch, depending on the needs. And I tell them before they leave that first visit, we have a lot of good things here. We have a lot of good people here. I want you to try everything slowly and then communicate with me because I'm never going to know your body as well as you do.
Right.
Like when you do the cupping, you do the acupuncture, you do the hydrotherapy, you do the electric stim, and so on and so forth. Tell me what works for you and what you didn't really feel much from. We throw out the stuff that doesn't work, we keep the stuff that does, and that's your routine.
Right. Because
That's it. It's what works for you.
a different assessment for the various individuals. It depends, right, on what you got going on, right?
It depends on the person. It depends
Yeah.
what they're responsive to. It
Right.
depends on their diagnosis.
Right. Based on data we have today, right? What can you say chiropractic can effectively benefit?
Oh, wow. Just from my own personal experience, let's go top to bottom. Anything from headaches to neck pain to normally thoracic pain. You have posterior rib displacements that happen a lot that are
Right.
often non or misdiagnosed. So people don't even realize what's going on there. Any joint or shoulder, elbow, wrist, hip, knee, ankle, lumbar, sciatica.
Sciatica is a big one.
Sciatica is a big one.
Sciatica is huge. Chiropractic.
It's how I got into chiropractic, if you want to hear that story.
Yeah, let's talk about that for
All
sure.
right.
Yeah.
In my late 20s, it's, late 1990s, showing my age, right? And I was going to meet a buddy of mine downtown. I lived in the city. When you're that age, I had the long hair, a couple of earrings going.
Yeah, for
It's
sure.
hot, so I got the tank top shorts
You were
on.
trendy. You were trendy, man.
I did my thing. I had my time.
For sure.
And jump on the train. And I don't know what I did, but I reached for something early that day. I just felt like a twinge.
Right.
I don't know. Grab up on the railing. Boom. 10-man Wizard of Oz time. Felt like someone stabbed me in the spine.
Right.
I was frozen, man. Uptown, downtown, uptown, downtown, 3 hours.
Mm.
Finally, some dude sat down in front of me. It didn't look like he was going to steal my wallet, shoes, and kidneys. I'm like, sir, can you help me?
New York is like that, especially in the 90s, man. New York was different.
Oh,
right?
yeah. The Chris Armani suit. He's reading his paper. Again, I'm dating myself.
For sure.
And he looks up and just gives me a quick glance because I don't have any money. I'm like, because I'm a sweaty mess. 3
Yeah.
hours I'm on this non-air conditioned train.
Yeah.
I'm like, no, sir, I don't need any money. He goes, what do you want? I go, I threw my back out. Imagine having this conversation with this old stranger.
Random guy,
I
yeah.
threw my back out. Can you help me up the stairs? Whatever stop you get off. What? I'm like, okay. He's disgusted, So of
Okay.
course he gets off on Wall Street,
Right.
gets me up the stairs. He doesn't want me touching him. I don't blame him. I get up there. I don't even remember if this was the day of beepers or the big phones with the antennas.
Right.
But I called my girl at the time, and she goes, "Stay right there. I'm going to pick you up, take you to see my chiropractor." I never heard the word before,
Right.
and I was just kind of drifting through life at this point. Not really having a direction.
Yeah, young man.
Oh yeah, man, having a good time. And she took me to see her chiro. Guy fixed me right up, and I had a conversation with him. I was on the phone with schools the next day. Sold.
Get out of here.
Sold.
Oh, wow. And I definitely want to get more into the background of that later in the interview. But explain to people what sciatica is. A lot of people, just like first time you heard chiropractor at your age, a lot of people around that age, right? They don't even know what a chiropractor is, right? Yet alone sciatica. So let them know what sciatica is.
Sciatica, let's make this as simple as possible. Here are your hips, right?
Right.
Your hips are parallel to the L4, L5, S1 vertebrae, all right? And that's where the sciatic nerve lives. Say your hips are off by this much, right? Which means you got one leg shorter than the other by this much.
Okay.
At this point, you're never going to have sciatica. You're going to feel achy, dull, stiff, uneven, because all that inflammation and spasm is spread out through your paraspinal musculature.
And not to cut you off, but because I remember one of my father's friends when I was a kid, he was born with, I guess it's the hip. I don't know. You tell me, correct me. But it was like almost like one leg was taller than the other, longer than the other. And he would have to actually, they recommended on his foot, kind of like a
like a
thing.
heel,
Yeah,
cup,
like
or
a
lift.
heel so that it could balance him out. What?
It happens. Some people are born with shortened femurs.
Right.
Others, it's a congenital hip problem. There's a bunch of different
Right.
malformities that can cause that,
Right.
but all easily corrected.
Is it the chiropractor that recommends the heel on the shoe for somebody for his situation?
I would think it would be a pediatrician
That's
to
the
begin with,
pediatrician, right.
but a podiatrist with a primary, a chiro could, You know,
Right.
anyone who actually can see what's going on there and
Right.
see it as a
That's why I went
structural.
off board there. But
No, it's
back
all
to
good.
sciatica for people that don't
All
know.
right. So
Simply just
hips are
put
off
it
by
for
this much, achy, dull, stiff. Hips are off by this much, and that quarter of an inch, all that inflammation spasm is centered right by that sciatic nerve. You can put on a sock, you can be benching 550, doesn't matter. Your body's in a position to fail. Nicks the nerve, sharp pain right in the middle, right between the hips over there. Sometimes it could shoot down the leg, it stays above the knee posterior.
right.
Other times it could just stay there, and you might not be able to get out of a chair for an hour or a week.
And that's the worst, right? I hear when folks tell me that it reaches out, stretches out to their leg, right? It's almost like
Yeah, because when that nerve is activated that way, all your muscles going to spasm too, from your quads, PT, IT, hammies, quads, calves, you name it. It's spasm. It's going to go where it wants to.
right,
And then the longer it stays that way, this is the tricky part, the more your body thinks of that as normal. Muscle memory. So
right.
even after I fix you, after I take pressure off the nerve, we don't know if it's going to stay that way if you let it go too
Right.
long, because then your body says, this feels great.
Right.
It's not what I'm used to anymore.
Almost like
Let me
you
go back
gotta
to what I know.
rewire the. It's almost like you gotta rewire the brain and body, right? Through treatment, maintenance, right? Maintenance is so important,
So important.
right? You can't expect to come in and folks are gonna come and see you and they're just gonna be feeling better off the first couple visits, right?
You're going to feel better, but just for a certain amount of time,
Right.
you know?
Then you come back. As far as maintenance goes, what do you recommend your clients? How often should they be seeing you? I know it varies on clients, some more than others. What can we say about that?
I prefer clients come in twice a week. I tell them you don't always have to do the same thing. Maybe one day could be acupuncture, one day could be adjustment. If you want to do adjustments, great. I don't ever recommend back-to-back days doing the same thing. There's nothing wrong with it. It's just I don't feel it's effective.
Right.
And let them come in at that and just do what they need to do for themselves and what I need to do for them a couple of times a week. And what I preach to everyone is don't wait for pain. By the time you're in pain, we're just undoing what's there.
Right.
It's a band-aid on a broken arm.
Right.
We're never resetting muscle memory. We're never putting you in your alpha posture in a more permanent situation. It's just so if you come in when you don't feel pain, that's the right time.
Right.
That's when you keep yourself feeling good. So you keep working out, keep working, keep living your life, doing everything you like to do, and not worry about
Stay
it.
ahead of it.
You brush your teeth, so you don't need a root canal, right?
That's true.
Same concept.
Yeah, absolutely. That's a good way to put it.
Spinal hygiene, man.
Yeah, that's a good way to put it. What lifestyle changes do you recommend to your clients, right? And again, it varies with clients, right? Can you talk about a few lifestyle changes you have made or have suggested to your clients? Whether it be, listen, man, you got to cut down on the sugar. You're diabetic, and it could also be leading to other complications, inflammation, right? So what are like lifestyle changes that you recommend? Diet changes. I know now in like holistic medicine, they do like cycles, right? They have
Mhm.
like cycles and stuff like that when it comes to diet. Let's talk about that a little bit.
I'll be honest with you, I pretty much stay in my lane.
Okay.
If someone's got diabetes, if someone has something else going on with them, if they're looking for weight loss, things like that, I refer them or ask them to go to their primary care physician. I think everything should start there. I have no hubris that says I know more than this person or that person.
Right.
I think once it stops becoming about what the patient needs and what the doctor wants, it's not what we got into medicine for.
Right.
And that's something that's been lost.
That's interesting. That's interesting because some chiropractors, they like to get into into the lifestyle changes in the diet and stuff like that. So the fact that you don't, I actually think you run a very legitimate and you're very trustworthy with your clients from what I'm understanding.
Thank you.
Yeah, for sure.
But to answer your question fully, I never try to change their lifestyle. People want to come in. I have professional athletes. Everyone's who like weekend pickleball players.
Right.
People just want to stay in the gym. Unless there's really something that I feel they're going to do harm to themselves with, I go, do you. My job is to undo you.
Right. And that's my next question. Do you feel like there's any risk in chiropractic
No,
that could run
no, now when you know what you're doing,
when you know what you're doing, right?
yeah, you don't
Let's
want to go
talk
to a
about
bad
if you
mechanic.
let's talk about if you don't know what you're doing and you're a chiropractor, you're going to a chiropractor that isn't all there, right? What complications can you potentially face from that, from visiting a bad chiropractor?
Yeah, well, I mean, I think the stigma that comes along with it.
Because listen, me, I cut hair, right? So it's like you come see me, you'll get a bad haircut. You come see me, you'll get a good haircut. You go to another barber or a barber that's not as sophisticated or as knowledgeable, you get a bad haircut, the hair is gonna grow back, right? But this is a little bit more serious. This is our body, right? So,
No, a
but
bad haircut's pretty serious.
nah, it is serious if you got something going on, but it's gonna grow back, you know. So you'll be good, but
You definitely don't want to go to someone who doesn't know what they're doing. I mean, there's no danger in coming to see me. I mean, people have talked about this has happened or that has happened. You have, I mean, honestly, in my office and in 99.9% of chiropractic offices, I'm pretty sure that you have a better chance of winning the Powerball twice than to having
any
a
risk.
seizure or stroke or something that's been associated with the profession. You know, I don't know what's happened to people who have had those things. I don't know where they were. I don't know what their pre-existing conditions were. I have no idea what's going on there.
Right,
I
right,
just know that I do my due diligence with medical history, and I know what I'm doing with my hands to where
right,
there's no fear there.
right, right. Medical history, great. You keep adding on to my next question. My next question is, how do you keep yourself up to date with the industry, with chiropractor, new methods? And
I read the newsletters. I watch the videos. Some of them are crazy, by the way.
yeah,
People come in and they'll ask me like, I saw this on TikTok or Insta. Can you do this adjustment? I'm like, nobody should be doing that adjustment.
like
That's not an adjustment. That is not taught in
that's
schools.
social media adjustments, man.
Yeah,
It's
that's a
not-
social media adjustment.
Yeah, yeah.
That's a follower adjustment. Yeah.
Nah,
So,
nah, nah.
but I mean, I always try to learn from other people. I never think I know more than anybody else.
Right.
So if anyone's willing to teach, I'm willing to learn. And I do check, I go to seminars, take my CE credits. I try to do as much hands on as possible. Will I incorporate all of it? No, I think there's a lot of stuff out there that's all bells and whistles.
Right.
There's a lot of terminologies and, techniques and things like that. And some of them are very, legitimate, but others are just meant to hype it up. And I don't
Yeah.
do the hype.
Let's talk about techniques.
Mhm.
Off the top of your head, just throw a few effective techniques.
Constant, diversified, drops, activators. You caught me out there. I'm missing like a bunch that I do myself.
Yeah.
But those are that's the bread and butter right there.
Right there, those are the bread and butter. Yeah. Before we get into acupuncture, right? Let's talk about your massage services
All right.
that you're offering, because I saw that on the website as
Yeah.
well. You have a few, right? You have a Swedish massage, hot stone massage. Talk to us about all the other massages you
All the
offer there.
massage therapists are trained in various massage styles.
Right.
Usually they come to me with some sort of training in a couple of them at least, whether it be lymphatic, medical, sports, hot stones, what have you. And we try to make sure that everyone knows everyone else's techniques. So I have them teach each other. And then they learn, and then they practice, well, on each other and on me. And when they're ready to do it, they work on patients, and
Right.
everyone gets a 10 to 12 minutes. Usually it's a medical sports massage, how it's phrased, but there's variations, like the ones I just mentioned.
Right.
And it just relaxes the muscles, relaxes their minds, and it puts them in a position to succeed and really have the effects that I want them to have for as long as possible.
Absolutely. You say it lasts about 8 to 12 minutes, each of these massages?
10 to 12.
10 to 12 minutes.
Mhm.
Yeah, usually done in the beginning of the adjustment. After, how's that?
That's another one that I leave up to the patient. I mean, sometimes if they're really tight, I make sure they get a massage before they get the adjustment. If I can't get to the bone. But I'm pretty heavy-handed. I can usually get to the bone.
It varies.
It
It
varies.
varies on the
And I
patient.
tell everyone, try everything every single way. A lot of people, this is before and after their workout. I go, do the adjustment beforehand. Do your workout. Come back, relax your muscles with a nice massage and some therapies.
Right.
Then try it the other way. Everything before, try everything after. See what your body responds to.
Right.
Whatever your body responds to, that's what you should be doing.
Right.
But if it stops responding, you switch it up.
Right. Right. Yeah. Any industry, especially any business, when it comes to that, to dealing with people, it varies. It's not just set in stone. What is a Swedish massage, man?
What is a Swedish massage? It's basically it's a technique. It's more of a light massage. It's definitely more of a needling and getting into the soft tissue more across the entire region of the back, as opposed to like say a trigger point massage or something of a medical massage to where it's focused on a certain area. The Swedish massage is when you think of a spa, when you go in there and they kind of work in the whole area. That would be more of a Swedish massage.
Okay. Hot stone massage says it for itself, right?
That says it for
Hot
itself.
stone massage. Yeah. Aromatherapy massage.
Aromatherapy massage, it's really more for your mind than your body. You gotta
Certain
relax.
smells. You
Certain
get
smells.
the hot vapor, right?
You'd be
From
surprised how
the
many
vapor
physical
machine.
symptoms come from stress,
It's
from
all about the
psycho.
mind.
You ever been injured? You ever got hurt? What does that give you? Depression, fatigue, stress. It goes the other way around too.
Right.
If you're depressed, stressed, and fatigued, then quite honestly, who isn't?
Yeah,
Of
absolutely.
course that's going to have physical manifestations. So to be able to relax your mind that way, with just some pleasant smells, a nice touch, some relaxing music, it makes a difference.
Absolutely.
Some.
Absolutely. Deep tissue massage and then a sports massage. Those are the last two on the website there. Let's get into deep tissue massage. For people that don't know, many people have gotten deep tissue massages, but for those that haven't, what can you?
The main difference between a deep tissue and a sports massage is that deep tissue really focuses on an area with the massage therapist using various parts, like not just her hands, but her elbows to really get in there, to get that spasm, to get that trigger point, to increase, flexibility and blood flow in that area. Where a sports massage does the same thing, but includes range of motion and passive and active exercises during the massage to extend range of motion for the usually it's for the extremity.
Yeah, that's more for like athletes.
But anyone who's active,
Right. Let's get into acupuncture now,
okay.
right? And a little bit that I know about acupuncture, ancient Asian medicine, right? Before it was all about the chi and the energy
The
and
third eye opening,
yeah,
yeah.
yeah. Today, 2024, what can you tell us about acupuncture?
Just from a medical standpoint, I'll tell you straight up, it's my go-to. Whenever I feel pain, discomfort, I start with acu and cupping. The acu, and I don't want to speak for the acupuncturists. They know 100 times more than I do, 1,000 times more than I do. But I know it hits all the right trigger points. And acupuncture is crazy. I mean, you can walk in there and you can say, I've got wrist pain. And you're going to end up with a couple of needles in your forehead, and then the wrist pain's gone.
Get out of
So
here.
what they know is just light years beyond
It's its own
most other.
monster. Yeah.
It really is. The cupping I'm good at.
Yeah.
Cupping's great because the
Okay.
cupping basically say, let's go with your whole spine. So we take the cups, we suction them onto your skin, and basically in the area of inflammation, spasm, and you kind of go around those areas because you want to expand the map a little, so to speak. And then you leave it on 15, 20 minutes. And what it does is sucks out all the lactic acid and all the stagnant blood, the two things that cause inflammation.
Right.
And when it's gone, now you have the fresh blood circulating through the area, relaxing spasm, relaxing that inflammation areas, the areas of inflammation. And the best thing about it is, say you've got pain here, right? That's your spine. You got some pain right here. And now I cup you all along the lines. And all of a sudden we take the cups off. Pink, 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 even the area of pain, maybe a little darker. And then all of a sudden you get purple right here. Guess what? The area of pain isn't the area of problem. You've got something else causing that. So now it's like
Mm,
a treasure map for us. So
right.
now we know exactly what to work on.
Yeah, because you're really tapping into the nervous system, right? And that's wires on wires on wires
Yeah.
all throughout the body, right?
Yep. So if you can get a visual, a nice, easy X marks the spot,
Right.
to where to begin, and this is what's causing sciatica. Sciatica doesn't mean that just you hurt your lower back.
Right.
It's a domino effect. It's a chain. The whole spine's connected. So you can have something in the middle of your back that's causing that kind of tension, pulling the hip, nicking the nerve. So
Right.
now I know what to work on. Now I have a working diagnosis,
Right.
which
Right.
means your results going to come faster and more thorough.
Yeah, you're getting the data, you're extracting that
Mm-hmm.
off of the diagnosis. Tell us a little bit about the history, right, of acupuncture, chiropractor, and how now it's being used in professional sports and holistic medicine.
Oh, it's come a long way. I mean, it used to be considered on the outskirts, a fringe thing. And, modern medicine, I think it was modern medicine, was a little threatened by it. They thought it was all about taking away their drugs and their surgeries.
Right.
I'm not anti-drug or surgery. I just believe in going
Because it's
from.
natural healing. There's no prescription needed.
There really isn't.
Yeah, for a lot of acupuncture stuff.
No.
Yeah.
You just got to go from least evasive to most evasive. Stop where the patient is most receptive.
And in
Um,
sports, right? Players all across the MLB, NFL have used acupuncture, right? Kobe,
Acupuncture, PT, Chiro.
Aaron Rodgers,
Yep. Big proponent.
Shaq. So you know
Yep.
they've used it
Yep.
and
And
they
all these
swear
guys have
by it.
used the cryo machines.
Yeah,
I mean, their bodies, those are their instruments. So I mean, they try everything, and they have the perfect cocktail to know what they respond to. I mean, they're professional athletes
right. Who else? Who else but them? They're out there every day.
every day, and their bodies take a beating.
Right. How do you feel about certain practices that sell product in acupuncture? Do you know about certain products like a product called Evil Born Water? You ever heard of that?
I've heard of that one. I've heard of others like it.
They sell herbs too. Some practices sell dry herbs, some pills. Can you
Not a
give us
fa-
some information on that, or is not?
Without judging them or their products or their business model, I personally do not do it.
Right.
I won't even sell a hat. I'm definitely not selling herbs. I'm not selling cupping sets. I'm not selling
No t-shirts,
vitamins.
no cups, no coffee cups.
Nope.
Yeah.
Because I mean, like, listen, I'm a chiropractor. Again, I got to stay in my lane. I have not done blood work on these people. You know, go to your primary, get your blood work done, find out which vitamins are best for you. Do your own research. It's
Right.
out there. I am not going to sell you products. I will sell you my services. You will have my time. You will have my expertise and my knowledge.
Right.
But I'm not taking money from you for some magic beans.
Right.
Again, no disrespect to the
Right. Yeah.
people,
No.
but
That's just how you run your practice, right?
yeah.
When do you recommend cupping to the let's say, all right, let's say you have a client, he's been coming to you for a few weeks now, right? He's been getting adjustments, right, through
Mhm.
chiropractic. When do you recommend the cupping? When do you say, you know what, I feel like cupping can benefit you
Usually by the third visit.
by the third visit?
By the third visit, because even if they're getting the results, I want to see if they can get results faster.
Right.
I want to see if they get different results. I want to see how it can accelerate the process for them.
And when do you throw them into the
There's no wrong time to go in there.
to the chamber, man?
That is just the cryotherapy is fantastic.
You can't take too much cold.
No,
right?
3 to 5 minutes, something like that.
5 minutes.
Yeah, it's just
You feel rejuvenated.
you feel rejuvenated. It's a decrease of inflammation and increases range of motion, takes pressure off the joints, relaxes the muscles.
Right.
Its benefits are, through the roof. That's
'cause
why
I
like most
see-
professional soccer teams have them in their training facilities.
Right. And I've seen guys like Floyd and other boxers,
Oh, yeah.
Devontae Tank Davis, Style Tank, by the way, that have used it and that have gotten in it. You know, a lot of cold plunges too, right? Cold plunges help too, but this you take it to another level with the
That's
chamber.
another level. Yeah,
Yeah,
the cold
this-
plungers, I think, just give you a jump to your circulatory
This
system.
is another level. So you're doing 2-a-days. You're an athlete, whether you're in college, right, in the league. You need this.
You
This is gonna push you to really work out more. It's like you gotta think about your body as like an engine, right? Overheats, right? This kind of balances it. Could you say that? Or
Yeah, that's a good
pretty
metaphor.
much
I
it,
mean,
right?
like if I'm the oil
I'm trying
change,
to put it in layman's for them so
Yeah.
they could kind of like understand. You know what I mean? People
Yeah.
that don't know.
no, if I'm an oil change, this is you know, you're souping up the what do you call it? You're making it into a V8 from a V6.
Yeah, for sure.
You're
Yeah,
supercharging it.
because you could push for more with that machine.
Absolutely.
Okay. So physical therapy, right? Let's get into the physical therapy now. And you know, because it's all on your services, right? This all goes hand in hand. You were saying in the beginning of the podcast how, you know, you do the chiropractic and then you offer the cupping and then it's all physical therapy. It's all the same thing, right? How do you package it to them? When does the package come into play? Like you said about third, fourth visit, you pitch the cupping.
hmm
How does that all package together? Acupuncture. everything.
PT might be in there for the first or second visit.
Right.
Depends on the patient's needs.
Right.
I mean, that's where everyone always asks me, what exercise do I at home? What stretches can I do? What's the difference between eccentric and concentric exercises, active and passive? And I'm like, let's talk to the physical therapist. Let's do some stretches. Let's see what your body responds to. Let's put you on a program right now, and then we break out the bands. We work through some motions, and then the PT does their evaluation with that. But they work the muscles, which is very important. It can't just be the bones or the muscles or the information or the chi or what have you. It's got to be everything in once. That's the whole point.
Are there any misconceptions about chiropractic, cupping, acupuncture that you want to address? Any misconceptions that there are in the industry that you might want to touch upon?
Um, I think the only misconception is that if you like, okay, so for chiropractic, they say if you do it once, you have to keep doing it. It-
That's the narrative.
That's the narrative. It, it's not a drug. You're not addicted to it. Basically, what's meant by that is after you get an adjustment and you see how you feel differently after as opposed to pre, you want to keep doing it because now your body knows the difference. Now you understand how you can feel as opposed to the way you're accustomed to feeling. How you can perform as the way you're accustomed to performing. So you want to keep doing it. And yeah, if you stop doing it, if you stop working out, you're going to lose muscle.
Right.
If you stop doing anything, you're going to stop the benefits of doing that thing. Stop, taking vitamins. You don't get those vitamins, right?
That's
It's
right.
just you do it because it's good for you because it feels good
Right.
and because you get the benefits.
It's not like you could eat broccoli once a month and say you're
Right.
healthy eating, right? See the benefits of that. How do you said in the beginning of the interview, you like phone calls, text messages.
Mhm.
That's how you like people to solicit your services.
Yeah.
So we got that out of the way. How often or how long are your appointment blocks? Because I'm a barber, so I'm usually seeing clients anywhere from 30 minutes, 40 minutes to an hour, depending on the service, whether it's haircut and beard, whatever. What are your appointment blocks like? A day in your calendar. You're blocking out 40 minutes, an hour for a client. What's that
I
like?
usually block out between 4 to 5 patients per time slot, just because we have all the different services. What I don't believe in is waiting rooms. I hate waiting rooms. I hate waiting for doctors. I hate
Okay.
people waiting for me. So 4 to 5 people we can handle without any kind of wait list. There's always someone on the table. The initial is going to take a little bit longer because we have to talk. There's a little paperwork, so maybe that's a 40-minute visit. If you're going to do acupuncture, maybe that's a 45-minute visit. If you're going to do PT, Chiro, Acu, that might be an hour. Or say you just want to come in for an adjustment. You're in and out in 5 minutes.
Oh wow.
So a lot of people, they don't have an hour. You know, a lot of people, I'd rather have them get something than get nothing. So I always tell them, tell me how much time you have. I recommend you do what you're supposed to do. But if you can't do everything for whatever reason, then let's do what we can.
Right,
I'm never going to not take you because you can't do what I want you to do.
right, right. Yeah, it sounds like you're running a tight ship over there, man.
Do what we can.
Yeah, yeah, it really does. What are the challenges you face, right? Owning a business like this, running a business like this, like you said, you have your professionals, you have your team. Let's talk about that. Anybody that wants to get into this and anybody that's already into this, what challenges can you say you face in this industry?
Uh, well, even though I don't like to deal with it, it's an unfortunate part of our business, insurance. I have to deal with insurance companies.
Right.
I see 40, 50 people in the next 4 or 5 hours, which is realistic. Um, I don't get paid. I have to pay my staff. I got to pay my rent. I have to pay my bills. And then I have to submit claims to the insurance companies. And it's not like they're just going to send me a check a lot of the times. They might send me a demand letter or send me some notes or this doesn't match up with this. And I guess it does. Oh, wait, we'll reprocess,
Yeah.
you know,
And you have to have somebody just working on insurance when it comes to
a
paperwork.
team of somebody's.
Yeah, because that could be tedious.
I got to do my notes. My wife, Manuela, who pretty much is the brains behind the business, she'd be the
Yeah.
face in front of it, believe me,
Right,
rather than me
right,
if she was here today.
Right.
She takes care of all that. And then it all starts with the insurance verification. You still
Right.
got to spend an hour on the phone to get a proper verification. There's only so much you can find out online,
Right, right.
and then it's just you submit the claims with the notes, wait for the response, hopefully it comes with a check, and rinse, repeat, rinse, repeat, rinse, repeat.
Over and over again.
Yeah, so the bigger an operation gets, like I said, when I had 9 offices, I was waiting for 9 offices worth of money.
9 offices worth of insurances for patients. And
Yep. And in the meantime, with insurance, I've got my malpractice, I've got my liability. I've got all the insurances that come with being a medical practitioner
right.
that have to be paid for. Again, not complaining, not bitching or whining, but you asked me for my challenge. That's my challenge.
But
Actually being paid for my services properly.
for the young viewers at home, what advice can you give them if they want to pursue a career in chiropractor, acupuncture, this industry?
Um, choose. Make a choice. Make a choice to pursue something. Make a choice to talk to some people. Visit with them. I would never turn someone away if they say, I'm thinking of doing this. Can I just see what it's like for a day? Absolutely. And talk to your guidance counselor if you're in high school. See what kind of grades you need to get into a good college. Get those grades. Even if you don't need to get into a good college, any college where you can take the proper prerequisites to put yourself on a streamlined path. There's too many divergent avenues right now. You can get sidetracked. Oh, maybe I want to do this, maybe I want to do that. You know what you end up doing? Nothing.
Absolutely.
Try it all. Don't get me wrong. Live, enjoy, explore. See what's right for you. But if you think that's your path, stay on that path.
Absolutely.
And see what it's for you. And then what I did was I knew which prereqs I had to take. Because I found this later, a bit later in life. If I had to do it all over again, forget about it. If I knew in my early 20s what I figured out by my early 30s,
right.
This is plastic surgeon Beverly Hills time.
For sure.
Which, by the way, is a great career as well.
For sure.
But just a medical career. There's a prestige that goes with being with a doctor that's been lost over time. And it should be regained, not because you're a doctor, but because you help people.
Right.
You change lives, you save lives, you alter the course of not just but their future.
Right.
You do goods. Right. You can make a difference.
Right.
All you have to do is start by making a difference in yourself. Absolutely. By choosing to choose.
Absolutely. Yeah, absolutely. Wow, great advice. What are requirements as far as schooling and certifications?
A bachelor's degree with the right prereqs. Any guidance counselor or any advisor in your respective schools can tell you exactly what that is. You can contact the chiropractic or the physical therapy schools directly. They will send you what courses you need to take.
Yeah.
You could be in high school and call them up and get a reserved seat for the class of 2030.
Right.
You just have to have everything ready by that time.
Potentially, you could even go and internship, right, at some of these. You could call a practice up like yours.
Not only can you should.
Personally show up, right? You're 16, 17 years old. You want to pursue a career in this potentially after high school. You could just do an internship, right? You said you were willing to accept an intern, right?
Absolutely. Absolutely. It was. I mean, listen, the second I realized what I was doing, I had put up medical posters in my room. Like a kid with, cars or bands or what have you. I had the nervous system. I had muscles. I was, going to bed memorizing the sternocleidomastoid.
Yeah? How old were you, man?
I know, I was old, but, still, you felt like a little kid,
I see what you
I
mean.
just don't remember being, a little kid memorizing the curves in the Ferrari from my Miami Vice poster.
Yeah, for sure.
But this was my new Miami Vice poster.
Yeah, for sure. Miami Vice. Yeah, I remember. What's the average salary, man? What's the average salary average, right? Let's say average.
If you're working for somebody else, you can expect probably a low six figures. You can get to that 100 and change mark.
How do you break into that? How do you scale into that 100 and change mark?
Commitment, working for the right people, putting in the hours, and hustling. You got to hustle. You got to work. And if you want to go above that, then it's doing your own thing.
Right.
When you're not dependent on someone else to pay you your salary, where you deal with the insurance, where you deal with all the other stuff. But at the end of the day, there's no cap to what you can make.
It costs to be the boss, right? With great power comes great responsibility, right? You want to make more money, unfortunately, you have to deal with insurances and what the scalability of it, what comes with scaling, right?
Yep. So I would definitely recommend don't be greedy at first. Learn. Take your time.
Right.
The student loans, they'll take care of themselves. You'll get to them.
Right. So you said a bachelor's will do.
A bachelor's will get you into the Chiro or the PT schools.
Okay.
And then from there, like for my school, for instance, Palmer College of Chiropractic, Florida, it was year-round, 3 years, 3 months, including clinic. And the second you walk out of there, you take your board exams, boom, licensed doctor.
Oh, wow. And how much is school? You were just talking about, don't worry about your loans and this and that.
Because I don't think it's spending the money. So, like, say school costs I don't know what it costs these days, honestly. But even if it hovers around that six-figure mark,
Can we talk about your day? Like
My day?
what it was like when you were going to school, what the loan was? Can we talk about those numbers if you
yeah.
remember? Or?
yeah, I remember. I think it was close to the six-figure mark. At mine, I think it was like around 100.
For the bachelor's,
No, not for the bachelor's, for the doctorate.
for the doctorate.
For the doctorate. For the bachelor's, I went to Stony Brook. I lived in New York, so the tuition wasn't that bad.
Right.
So state schools, community schools are fine.
Right.
There's nothing wrong. There's great community colleges out there.
Right.
We're not talking about you have to be a Harvard graduate to
Right.
get into any profession.
Right. When did you decide it was time to go get my doctorates?
When I decided I was going to be a chiropractor.
You need it, right?
Yeah. I mean, I had my bachelor's, but I had my bachelor's in English.
Yeah.
You know,
Yeah.
I was wanting to be a writer.
Right.
So
Interesting.
I went back and I had to take the biologies, the chemistries, the physics.
Right.
You know, obviously, if I was good at those things to begin with, I would have taken them to begin with.
Right.
And then from there, it's chiropractic school. And that's all the schooling, all the clinical work, and then it's the exams. And it sounds like a lot, and it is a lot, but it's not all at once. You know, they break it down for you. You know, and then I never thought of it as spending money. Never thought of it as throwing money away. I was investing in me.
Absolutely.
So you got to believe in you.
Absolutely.
You know?
It can't be done without school, though.
No.
There's no way.
No.
Yeah. You can't be self-taught. You can't be mentored and then not have the school, the certifications.
The degree cannot. No,
Cannot
the
be.
licensure cannot. A title cannot. The experience can.
Right.
What makes you good at your craft absolutely can and should.
So inspiring chiropractors, right? What opportunities and challenges are they going to be facing the first 4 to 5 years?
A lot
Besides schooling.
Besides schooling.
You want to get into an internship right away, right?
That's not going to be hard to find. There's always somebody going to be hiring or someone looking to, you know, help you out or take you on. You're going to find work.
Yeah.
Work's out there.
Right.
I'll hire you.
Right. So there's no issue there with finding work.
No, the work is there. This isn't something that's going to be taken over by AI or automated in any way.
Absolutely,
This is going to be a human being working on another human being for as long as we're going to know humanity.
Absolutely.
Right,
And it
this
goes
is
back
no-
to the therapy aspect too, right?
Mm-hmm.
You're talking, it's the human interaction. You know, like you said, you're your client's therapist as well.
Yeah.
Yeah. These kids, right? What other challenges can they expect? Because you're saying the challenge isn't in finding.
Look, not
Practices,
everyone they're going to
but-
meet is going to be a good person. Not everyone's going to want to teach them. People are going to want to take advantage of them. Maybe they lead them down a path that isn't the right path.
Right.
But guess what? That's the world.
Yeah, that's the
You
real
know?
world. It happens in the streets. It happens in corporate America.
And it's going to
happens
happen.
everywhere.
It happened to me. It's going to happen most likely to anyone unless they're really, really fortunate. And all you can do is learn from it. In my experience, there's no such thing as a bad experience unless you can't learn from it. There's no such thing as failure unless you repeat the same mistake that caused you to fail. If you fail and learn and don't repeat that again, fail a different way.
That's
Just
a
don't
fact.
fail the same way.
Absolutely.
Don't get used twice the same way.
Absolutely.
Don't get lied to twice the same way.
Absolutely. So now let's talk about you, man. Let's talk about how you got started, man. You have a business, Power Health and Wellness. You've been doing great. You've won awards. You have people that work with you, that work for you. Been running a legitimate practice
Yeah.
for years now.
Yeah.
How did it get started? Where did it stem? Where did it begin?
Honestly, one day,
I know you shared your story at the train with the sciatica, right?
you want to know where I began or where Power began?
I want to know where you began as a young man wanting to choose this career and this profession. What inspired that? First, let's start off with where you were born, where you were raised, where your parents are from, if you don't mind getting into that.
No. I was born in Moscow. We came over on the first wave of immigrants in '75. We lived in the projects of Coney Island. And then my dad passed his dental exams, which was no easy feat for a man who barely spoke any English.
Yeah,
You know, to go to NYU Dental.
straight from Russia.
straight from Russia. And back then, like, like if you came over back then, whatever you had back then, you leave behind. Everyone gets 2 suitcases and $300.
Right.
They put you where they put you, and that's it. My dad, who was, a well-renowned doctor and dentist in Russia, came here and he's selling jeans on Delancey Street.
Wow.
My mother, who had a dental degree in Russia, is coming here. She's washing hair in a beauty salon.
That's the struggle of being an immigrant, man.
Yeah, so the struggle is real.
My Russian brother, I'm Cuban, by the way. My Russian brother. Nah, but yeah, that's what we face, man. When our parents, they're professionals in their countries, and when we migrate here, it gotta settle for lower paying jobs.
Can you imagine? I can't imagine.
It's rough.
They did it all for me.
It's rough, yeah. It's rough. So you started growing up in Coney Island in the projects. What can you say about that? This is the 80s? When you were growing up?
This was the late 70s, early 80s.
Late 70s, early 80s.
So this was not...
Let's talk about...
Not Disneyland.
Yeah, let's talk about Coney Island and the projects around that time. What can you share about growing up there?
Not fun.
Yeah.
No, not fun. But I mean, look, it's the projects. No one ever came from the projects ever said, I had a great time.
Had a great time, yeah.
Can't wait to go back. No, you're there to get out of there.
Yeah.
And then eventually we did. And I was raised kind of in the Coney Island Avenue between X and Y area. It's like right before Sheepshead.
Okay.
And ended up going to Zavarian High School, all the way to grade school, then Zavarian High School in Bay Ridge, and then Stony Brook in Long Island. I guess my dad was a dentist, so I guess growing up, you idolize your dad. So I kind of wanted to be a dentist. He was like, don't be a dentist. You don't want to be a dentist. I'm like, all right, guess I'm not being a dentist,
But you knew you wanted to be somewhere in the medical field.
I think it was always just around me, but somewhere along the line, I just lost my way. It's so easy to do. You just wake up one day, you're 10 years old, got nothing to show for, and you're like, I gotta get my shit together.
Shit.
I gotta get my shit together right now, like yesterday.
Fact. That's a fact.
And the longer you wait, the harder it is.
Yeah. So that was your point. That was your turning point. That's when you knew this is what you wanted to dive into.
Yeah.
Yeah. What inspired it besides your father? What else kind of lit up the light bulb? Like, yep, chiropractor. This is what it is.
I think I saw all my other friends.
And how old were you at the time when you hit that turning point?
At the chiro?
What time was this? Yeah.
We're talking like mid-20s.
Yeah.
Mid-20s when I figured out, like, I'm going nowhere.
Right.
Bartending a couple of shifts a week is fun.
Yeah.
That's not going to get me.
What other jobs did you have growing up as a kid? You were bartending?
Oh, when I was a kid, I mean, I've been working since I was very young. So every summer you're mowing lawns, every winter you're shoveling snow. There's the paper route. There's the, because they used to have parties in the yard. So my job was basically serving the kebabs and pouring the shots and working on tips there. So I guess I was always in the service industry, so to speak. And I had a couple of corporate jobs, like pharmaceutical sales for a hot minute. I hated it. Oh, did I hate it? I mean, I don't know. Every single thing about corporate America was just not for me. It's got its place. Listen, it's great. Everyone who does well in it, God bless them. But definitely, I hated it. So somewhere in my mid-20s, I'm like, I got to figure something out.
And chiropractic was it. Chiropractic was it.
It came to me, man.
Physical therapy, all of that.
Yeah.
Where'd you go to school?
For Chiro?
Yeah.
Palmer College of Chiropractic, Florida, which is right by Daytona Beach.
Oh, okay. So
that was cool.
Yeah, well, when did you? So you moved? At this point, you moved on your own, or you moved with your parents?
No, I moved on my own
to Florida, and that was because of the school.
Yeah.
That drove that decision, I'm guessing, right?
Yep.
Daytona Beach back then, right? So.
This was post. This was already the early 2000s, so the MTV days were done.
Yeah.
Listen, it's still the beach. You're still enjoying yourself, but it was there. I was there for work.
You were able to focus?
I had no choice to focus. I was probably one of the oldest kids in my class at this point.
Right.
I'm turning 30. They're turning 22. Right. They have their shit figured out early.
Right.
I'm like,
you just had your turning point. You were just like, all right, yeah, I gotta figure it out. I gotta buckle down. I was
out of strikes.
Yeah.
It's either do it for real or don't do anything.
Go in or go home. Yeah, all or nothing. So you did college there for 4 years?
Hmm?
You did college there for 4 years?
3 years, 3 months, exactly.
3 years and 3 months. And then what happened after that?
After that, I got a couple of jobs with a couple of different chiros. Tried out my own thing. But
You interned, I'm guessing, or no? You didn't do the interning? Or?
I did an internship and a preceptorship.
Okay.
I learned a lot.
How was your experience with interning? How many internships, how many locations were you in? And what
Probably
was that
2
like?
or 3 altogether between the internships and the preceptorships and the clinic hours. You learn a lot.
Good value over there? Getting good value internship?
Definitely. But I mean, I'm a hands-on, I'm a visual learner. So just even being a visual learner, watching somebody do it isn't the same. You got to put your hands on people.
Yeah, you got to be in the field.
You got to literally put your hands on people. You got to be the field.
For sure.
You know, so there's no other way of learning except doing.
Right. So what were some early challenges around that time? What were some early challenges? You know, you're already 3-4 years done with college, right? Now your internship. Where'd you land your first real job?
I opened up my own place. Me and like a couple of other guys from school. I think that's a lyric to a bad song. But we opened up.
This was before Power.
Oh yeah, this is well before Power. This is
What was
well
the first name of that project?
Oh God, I don't even remember.
You don't remember?
I couldn't even tell
You
you.
guys got together, opened up a little practice, or what?
Yeah, we'll practice.
Where
Everyone
at?
did their thing in Florida.
Yeah?
In Florida.
How'd that go?
It went, as you can think of it as
A trial run?
think of it as a garage band.
Yeah.
You know, you really think you're rock stars, you're gonna make it, but you're just a garage band.
Yeah.
You know?
Yeah. So it didn't go far.
No, it didn't go far. But it wasn't supposed to go far. We just didn't know it.
Right.
You know, then everyone went their separate ways, all amicably, if I recall.
Of course.
And then everyone did their thing. Some people stayed on their own. I just decided to work for different people. Some I learned a lot from. Some I learned a lot from of
what not to
what
do.
not to do, who not to be.
Right.
You know, and you can figure out who you are real quick in those scenarios.
Right.
What you're willing to do and what you're not willing to do, and how you want to be seen and see yourself.
Right. And that part of your story, couldn't you say you found a mentor? Or you had a mentor that really helped you out? Could you say there was one?
I did have a mentor that helped. I had a couple. I had a few people that were very kind and generous with their time and their knowledge with me. And
Not easy to come across, right? People that genuinely want to mentor you and
sometimes
you
they
in
don't
the
know
right
what they're talking
direction.
about. They want to help you, but they don't know how to help, or what they're thinking is help isn't really helping.
yeah.
You know, I don't need to sit there, just have someone on their soapbox talking to me about their beliefs, which is nice to hear, but it doesn't help me.
Right.
You know, I need to know, like, how do I create a practice? How do I respect the ethics and morals of my profession? How do I build a future for myself and my family?
Right.
These are the things I need help with. How do I get better with my hands?
Absolutely. Yeah, absolutely. How long were you in the field? Right? Literally in the field before you opened Power Health and Wellness.
Power Health got open in 2017. I started this in 2006. So 11 years. That's a long internship, man.
Did you always know you wanted to have your own?
Yes.
Off the rip, you always knew.
Yeah.
Ownership, right?
Yeah. I wanted control of my patients. Not control my patient, but I wanted to be able to control their treatment.
Right.
I wanted my own staff. I wanted to control my own income. I wanted to build my vision.
Right. So now let's talk about the early challenges in creating Power Health and Wellness as a company. Let's talk about those challenges.
Yeah.
Yeah.
So, I mean, there's the stuff, swift filings, form a corporation.
Step one.
Step one, right. Dude, step one is everything.
Yeah.
And it's literally like a checklist. And when people actually ask me, how do I do this? I'm like, because you don't know where to start. That's the biggest thing. Where do I start? It seems unattainable because you don't have a step one.
Right.
Once you get that step one, form a corp. Get that EIN number. Bring it to the bank. Have a checking account with a debit card. Call up your old school and tell them what insurance do I need. They'll give you an insurance carrier.
High school might not teach you this, but high school might not teach you none of this.
No, college isn't going to teach you any of that stuff.
Isn't it crazy? Right?
Nothing. No real world experience has been learned. At least I didn't learn any of it.
Right.
Maybe I wasn't paying attention back then.
And what age was this? Dealing with these challenges of opening a corp and getting the number.
Those I figured out relatively early. Those I figured out in my early 20s.
Your early 20s. So
how to make
when
those
it was
corps run.
So when it was ready to open power, you already had that knowledge. You already knew what you had to do, how you had to go about it.
The ABCs I knew.
Right, the ABCs.
But now,
after the ABCs now.
Now the hard part.
Let's talk about
Where
that.
do I practice? How do I get patients? Where do I get staff? How do I train this? How do I even come up with a logo?
Yeah, enlighten us, please. Enlighten us on all of that.
It's all trial and error. You take the lessons you've learned, and it's still trial and error.
Yeah, for sure.
You try to hire the right people, it's still trial and error. Some of them stick, some of them don't. Some of them you can trust, some of them you can't.
Yeah.
Sometimes you can't trust yourself because you're the one in the wrong.
Self-accountability, right?
Yeah. But anyway, I decided to do the gym route. Now I gotta find gyms who will let me in, who will let me work there, who will charge me a reasonable rate, and where I can build up a patient base. And one gym led to two, and dude, within a span of a year and a half, I was turning them away.
Wow.
I was like, I can't.
Too much demand.
Too much demand. And then, of course,
COVID.
Now you missed the demand because now all the privately owned gyms, a lot of them aren't around anymore, or not big enough. A lot of people went the personal training or group class route, which isn't really...
post-COVID, right? This is post-COVID, you're saying?
Yeah, post-COVID.
This is what that cost.
And group training, great gyms, but doesn't have the turnaround that I need to be successful for my kind of business.
Right.
So and then there's the corporate gyms. Good luck with that. There's always a decision maker, but try getting to one. Why would anyone want to put you up there? What's in it for them?
Right.
So there's a lot of health fairs, and this corporate gym or that corporate gym. I don't want to name names, but all the big ones that didn't amount to anything.
Right.
Was a waste of time. Now, I still got to practice my craft. I still got to help people. I still got to meet people.
Absolutely.
Did I earn money doing that? No.
No. Yeah, but you learned lesson there. Got value there. It's never a loss.
Never a loss.
Always
if you
a
learn
lesson.
from it, it's never a loss.
Absolutely. Just don't commit the same mistake again and again and again.
And again and again.
Oh man.
But that's the tricky part with stuff like that is that you almost have to commit the same mistake over and over again. Otherwise, you got to stop trying.
Right. All right. What skills do you think an individual needs to not only run a successful business in this field, but even if they don't have their own business, what qualities as a person, as a professional, are you going to need?
Integrity, commitment, dedication, and you got to work hard. You got to hustle. If you're going to own your own business, 9 to 5 does not exist for you if you want to be successful. It's 25 hours a day, 8 days a week, and that's if you took a day off. You got to work. But here's the thing. If you love what you do, if you believe in yourself and what you do, it doesn't feel like work.
Absolutely.
Come Monday morning, I'm ready to go.
Yeah.
Yeah.
What do you enjoy most? What fulfills you most about this?
Okay. I'll give you my secret. The secret to my success. So I think that'll answer your question.
Absolutely.
Everyone's patients love them. Every doctor, their patients love them. My secret is that I love them back. I really do. I adore them, every single one of them.
Right.
So when I come in and I see them and I get to interact with them and talk to them, it is not work for me. This is absolute joy, Right. And I've never once seen anyone as a dollar sign. And the day I do, and I hope that day never comes, that's retirement.
My man doesn't even have merch. So he doesn't even have a T-shirt or a hat he couldn't even sell you if he wanted to.
No, I give them away. someone asked me, where'd you get that hat? Where'd you get that gear? I'm like, I'll hook you up.
Doesn't sell it, you know? So that alone should tell you a lot. You know, so it doesn't feel like work. You're truly passionate about it. Hard work ethic, momentum, right? Especially, I guess, challenges really lie in like building your book, right? Because I remember as a barber, the first 2 years even, it was rough, man. Like, you had to be there all day. Nobody would walk in. You'll maybe cut 1 hair, 2 hairs. I'm sure you had a fair share of those where like you only had 2 clients in a day and you were just waiting. And
you never know when those days will come. It could be your first year, it could be your 21st year, and those days are fucking depressing.
yeah.
You know, you put a couple of those together, you start questioning things.
How long did it take you to build your book to where you can say it was self-sufficient, to where you already knew this week and next week and it's already booked out?
I don't think I've ever gotten there. I don't think I can ever tell myself I'm there. I believe if you have as a business owner, as a professional, if you become, say, I made that book, that's complacency. You choose not to move forward. You say you've made it.
Right.
I've never made it.
Got to keep growing. Always room to learn more. That's a key too, right? Anything you want to share with our viewers before we wrap this up? Anything we might have missed? Anything you want to clarify? Anything you want them to understand about the industry, the profession?
I'll give you a quick story just to finish up our point that we were making.
Of course.
I was reading an article, and if I misquote anything, I'm sorry. I believe it was Jay-Z, right? And he's about to buy a piece of the Nets, and I forget the owner's name. I don't want to mispronounce it. Back then, he was buying it from, and they're meeting in the Pia Hotel. And Jay-Z's Beyonce, they got the penthouse. They're hanging out, and some guy knocks on the door and goes, Mr. is upstairs. And Jay-Z's like, upstairs? I'm in the penthouse. He goes, yeah. Turns out there's another penthouse.
There's another one.
And I love this. I love this about him.
Oh,
and I remember this to this day. He goes, no matter where you are, there's another floor above you. There's something always more to strive for.
This is Jay that said this? Yeah.
And if it wasn't him, I apologize, but I'm like 99.9% sure it was him.
Yeah, absolutely.
And just back to my business, if anyone needs me, I'm here. If it's just a talk, it's for an adjustment, it's for our services to help you, I am here for you. I sincerely mean that. We do in-house services where we do take, talking business, we take cash, we take insurances, both in and out of network. Every insurance is different. The insurance verifications are free. And then we come to your house. We do concierge services. So I'll come in. I'll bring my table, do an adjustment, do a Theragun massage, electric stim, cupping, and for that we charge. I think it's $350 an hour, or $350 for the session, I should say. And I walk out of there, and you don't have to leave the comfort of your home. So we've got, and that's Jersey, New York. I'm licensed in New York, New Jersey, Florida, and California.
Nice.
And I'm just trying to keep it moving, man.
Yeah, absolutely. Got to keep it going. Yeah,
Yep.
licensed in 4 states. Good shit. My God. Pleasure speaking to you today, man.
Thank you.
And you guys can find him again, right? We're in the recovery room in Edgewater, New Jersey, right? At fitness, at Iron Culture.
Iron Culture, yeah.
You have also Fitness
Factory in Hoboken and Excel Athletic Lifestyle, Excel, XCEL, and Hoboken as well on Marshall Street.
Right, and give them the website one more time so they can tune in to the website. All the information's on there, guys. All the services, everything we spoke about today, it's all on there. He even has videos giving you the background and the history of chiropractic and acupuncture. So a lot of information on the website.
That's powerhnw.com. That's H as in Harry, N as in Nancy, W as in William.com. Or you can email me, powerhnw@gmail, or just give us a call or shoot us a text, 973-878-9069.
There you have it, man. The man himself, Dr. Arthur. Pleasure. Appreciate you sitting down with me today.
Thank you, brother.
Doing this podcast. Yep, absolutely.